20,000 children are dying every day for the want of simple health interventions that cost less than the cost of a cup of coffee. Living Goods focuses on these high-impact, low-cost to treat and prevent areas. Diseases like diarrhea, malaria, nutritional deficiencies, and simple interventions in pregnancy. The supply chains for these essential products to treat and prevent these things are broken. Governments, particularly in sub-Saharan Africa, simply do not have enough money to field the health workers and to keep the dispensaries in stock. And that's why we're here. Living Goods is aiming to be a 100% sustainable solution to the diseases of poverty, and we think that's the only way you achieve a scale and the solution that matches the scale of the problem. What does Living Goods do? Well, what we do is we operate these Avon-like networks of community health entrepreneurs who go door to door, church to church, school to school, selling the cheapest, smartest, simplest solution to the diseases of poverty, particularly the diseases that are affecting young children.
And do they have mosquitoes?
Mosquito nets?
Nets. How many? What type?
Living Goods started and today works exclusively in Uganda. A key part of our strategy is to focus ourselves geographically. One thing Living Goods is really doing, in essence, is combining the best practices from public health, from microfinance, and from franchising models. And our goal really is to do for the health sector what microfinance has done for livelihoods, which is to create a fully sustainable, commercially viable system.
One of the most important factors of our success is this bond that develops between our community health promoter and the community in which she works and her clients.
One of the things SV2 asked us to do when we sat down to start this relationship was to do an organizational capacity assessment. When you are running a startup organization and going 100 miles an hour, it's very hard to stop and step outside yourself and look at your organization and see where your strengths and weaknesses are. It's been an extremely useful exercise. It's helped us focus on what the most important organizational capacity priorities are.
As a co-leader, I was delighted to watch the passion of the SV2 partners marry into the passion of Living Goods and its executive director, Chuck Slaughter. And we look forward to bringing the SV2 partners' passion and expertise over the 3-year grant round to making Living Goods as successful as it can be.
We'll be funding Living Goods for the next 3 years, and in that time we're really excited to see their capacity grow. We're excited to see them expand their reach.
Living Goods has a somewhat audacious vision. We want to show that we can dramatically reduce under 5 deaths by at least 20%. We want to show that we can do this on a self-sustaining, pay-for-itself basis. And then we want to get hundreds of large-scale actors to copy what we've done. Having partners like SV2 who have resources, talents, and connections that can help us achieve that vision, we think is going to be critical to our long-term success.